Autoimmune polyendocrine syndrome. Definition. Autoimmune polyendocrine syndrome is a rare, inherited disease in which the immune system mistakenly attacks many of the body tissues and organs. The mucous membranes and adrenal and parathyroid glands are commonly affected. Thus, other tissues and organs may become involved as well.
Hello, my name is Carissa Reinditz-Schultz. I have APS type 1, which stands for Autoimmune Polyglandular Syndrome type 1. I didn't find out I was sick until I was 9 years old, although we later found out that I had symptoms and signs. Had we had knowledge, I could have been diagnosed sooner, but we found out when I was 9, when I had a grand mal seizure on Mother's Day, and I had 2 more grand mal seizures that same day, and I was fairly lucky because they figured out my diagnosis of hypoparathyroidism and the APS type 1 within roughly a month of me getting sick. And then I started doing better. And then my story was a little different. After that, I got better and I was feeling healthy and running around, a normal 9-year-old kid again. And we didn't know that I also had osteoporosis. And I still don't remember to this day how it happened, but
Application and nursing. The treatment of autoimmune polyendocrine syndrome includes hormone replacement therapy and necessary and the treatment of complications. Patients must have a minimum of 2 follow-up visits per year due to the complexity of the entity and carriers of asymptomatic mutation should be followed at least once a year. Vaccination against meningococcal pneumococcus, Haemophilus influenza type B, and annual influenza vaccine.
Syndrome, autoimmune polyglandular, APS. Syndrome, autoimmune polyglandular, APS, a genetic autoimmune disease with an extraordinary array of clinical features, but characterized most often by at least 2 of the following 3 findings: hypoparathyroidism, underfunction of the parathyroid glands which control calcium, candidiasis, yeast infection, and adrenal insufficiency, underfunction of the adrenal gland. APS was the first systemic, body-wide, autoimmune disease found due to a defect in a single gene. By autoimmune is meant that the immune system, which normally wards off foreign invaders of the body, turns and attacks tissues such as skin, joints, liver, lungs, etc. of the body. Examples of common systemic autoimmune disease.
Pros and cons.
Autoimmune polyglandular syndrome type 1, also called APS type 1 or autoimmune polyendocrinopathy candidiasis ectodermal dystrophy, also called APECED, is a rare genetically inherited condition. Autoimmune means that the body's immune system begins to attack its own tissues, and polyglandular means that multiple hormone-producing organs are affected. Normally, your body should only react to things that are foreign or not self. This is maintained by a process called immune tolerance, where only non-self-reactive B cells and T cells are allowed to mature, whereas self-reactive ones aren't. For T cells, this process takes place in the thymus, where a gene called AIRE, or autoimmune regulator, is expressed by thymic medullary epithelial cells. When T cells are developing, this gene leads to the production of thousands of the body's proteins, and this serves as a test to see whether the T cells react to self-proteins. If one does, that T cell either undergoes apoptosis and dies, or it becomes a regulatory T cell, or Treg, that helps to eliminate other immune cells that react to self-antigens. In APS type 1, there's a genetic mutation in AIRE that's usually inherited in an autosomal recessive fashion. This means that the thymic medullary epithelial cells lose the ability to display the body's different self-proteins.
Autoimmune hepatitis and APS 1 can be aggressive and cause liver failure and death if not treated. Immediately, with high dose of steroids and astrioprate. More studies are needed to optimize immunosuppressive treatment. Monogenic autoimmune polyendocrine syndromes have provide an opportunity to learn more about specific factors that are critical for maintaining immune tolerance. There have been important advances in the characterization of autoimmunity in panties. Identification of new autoantibody target associations with different diseases and their manifestations. Issue applied in Ecuador. Autoimmune disease affect 5 to 10% of the population and large percentage of this compromise an endocrine gland. Any gland endocrine can be the object of the immune system and can often be multiple organs involved in the same individual. Being able to comfort autoimmune polyglandular syndromes. Conclusion. There are many pathologies that are associated with the different type of autoimmune polyendocrine syndrome, so that in primary care levels should be examined of more cations weigh and perform a good physical exam to detect timely symptoms that will lead to definite diagnosis.